One of the major problems is fatty liver disease. Excess fat in your liver is terrible for your liver function. Many people are always looking for ways to detoxify their bodies, and they're looking for that magic drink or the magic recipe that will keep them toxin-free. But they already have it inside. About 70% of the liver is made of cells called hepatocytes. They are the workforce for about 500 metabolic processes that keep your body toxin-free. If you want to detoxify your body, you must support your liver with what you eat. The leading cause of fatty liver used to be alcohol, but now the leading cause is excess carbohydrates. That's why you want to see this list of foods to clean your liver and keep your body free of toxins. Fatty liver is a major problem. It's a reflection of metabolic disease, prediabetes, and diabetes. A fatty liver just doesn't work as it should, and it'll put you at increased risk for heart attacks and strokes. It's very important to be conscious about what we eat. That's why we created this list for you. Here are the top 5 foods that clean your liver. Stay until the end because we have a surprise just for you. And as usual, we'll answer your questions in the Q&A. So, Jesus, you ready to bring up the slides? Okay, so we're going to be covering an article that went deep into the data, the evidence around dietary patterns, foods, and nutrients that will help with non-alcoholic fatty liver disease. It was in Nutrients Magazine, September of 2023. Number 1, nuts. They're rich in monounsaturated fats like oleic acid. Walnuts, for example, have a lot of polyunsaturated fats like alpha-linoleic acid, ALA. If you see the nuts here, these are the most helpful nuts for fatty liver. Hazelnuts, almonds, pistachios, and of course, walnuts. They reduce lipids or fats, glucose, and blood pressure. They're associated with a decrease of GGT. You may remember gamma-glutamyl, easy for me to say, huh? GGT, gamma-glutamyl transferase. It's what the insurance companies, a lot of insurance companies use in terms of looking at predictors of mortality. It also looks at ALT and AST. These are your standard, quote, liver function tests. They're enzymes that are found inside the liver cells that increase when you have inflammation or actual bursting of liver cells. We'll talk about that a little bit later in the show. Nuts are associated with reduction of liver fibrosis, and they're just plain old anti-inflammatory for the liver. Number 2, you probably guessed it, extra virgin olive oil. 80% oleic acid obtained from the ripe fruit. That's what that extra virgin is all about. It's unrefined. 10 grams a day decreases glucose, LDL, increases GLP-1s. You remember GLP-1s? Like that's Ozempic and all those weight loss drugs. They're made to look like a natural hormone that we have in our body called glucagon-like peptide 1, GLP-1. Extra virgin olive oil is also associated with fatty liver reduction by 39%. Now, this was a specific article that was covered in this Lit Review or Science Review. In that article, they combined extra virgin olive oil with a lower calorie diet. They decreased fatty liver by 39%. It was anti-inflammatory and antioxidative. So again, number 2 was olive oil. Number 3, fish. Again, not a big surprise. Omega-3s, EPA and DHA, eicosapentaenoic acid, docosahexaenoic acid for the geeks out there. You'll see today we've planted a few little of the technical words for the geeks that are interested. We won't spend any time on them. Salmon, mackerel, herring, sardines, other oily fish, and you might notice, as I did, that halibut wasn't listed there. It should be. Halibut's really good as well. Omega-3s decrease liver fat storage and liver enzymes. Remember, we talked about that. Those liver enzymes are evidence of actual bursting or inflamed liver cells. Fish, the omega-3s increase insulin sensitivity. It's anti-inflammatory. 6 months of increased omega-3s were found to reduce fatty liver. Number 4. Oh, gosh. Everything you look at these days in diet is being questioned. There's a lot of debate about fiber. Do we need it? Do we not? And again, we can get into discussions of that later. But one thing that you do need to remember about fiber is that it's a prebiotic. It creates some gut biome changes. You don't need the fiber, but your gut biome profits from it. The bacteria in your gut ferment the fiber into short chain fatty acids. The most important are butyrate, propionate, and acetate. And your gut biome is important, and so are those short chain fatty acids. Those short chain fatty acids reduce fatty liver. They have anti-inflammatory effects. Now, something that they said in this article that we don't agree with. They're big fans of using whole grains. They're big fans of that classic Mediterranean diet. And we get really concerned given the fact that everybody 18 and older, over half of us have problems with prediabetes, diabetes. We're very concerned about whole grains. So I'm not buying putting whole grains in the diet. Again, further discussion we can have about that. There are some whole grains that we would use, but unprocessed. So that's the big deal about grains. I'm not going to go further down that bunny hole because we've got number 5. Again, probably not a big surprise. Legumes. Increased intake of beans, lentils, peas reduces the risk of fatty liver. It can also decrease cardiovascular risk and, again, promote short-chain fatty acid formation in the colon. Now, we said there was going to be a bonus. Here's a bonus. Unsweetened coffee. Did you know that 2 to 3 cups a day of unsweetened coffee has been associated with a 29% decreased risk of fatty liver, 30 to 39% decreased risk of liver fibrosis. Fibrosis is scarring of the liver, a 39% decreased risk of cirrhosis. That's advanced scarring of the liver, and a 44% decreased risk of liver cancer just from coffee. Again, unsweetened coffee. For the geeks out there, again, another geek nugget, it increases PPAR alpha. I'm not going to go into the definition of PPAR alpha, but what PPAR alpha does is it oxidizes certain things. It's an antioxidant and therefore inflammatory biomarker or actor on inflammation. That unsweetened coffee also decreases collagen deposition, decrease connective tissue scarring. Let's put it that way. And unsweetened coffee is an antioxidant. We've got another bonus here, and it's egg yolks. Choline. There's been a lot of debate about choline, too, and we're not going to go too deep into that. Some people said it's an essential, maybe mineral type thing. It's not really a mineral. Others have said it's a vitamin. It's a B vitamin, an essential B vitamin. Others have said, no, it's not really a vitamin either. But low choline is associated with fatty liver. The liver metabolizes choline. Elevated choline is a protective factor for fatty liver disease. So another nugget for the geeks. Not going to go too far in that either. But if you look in the bottom right-hand corner, this is a little bit of a focus on how does fatty liver actually happen and how does it result in increased liver functions liver enzymes in the blood. What's actually going on? How does it create that fat? How does it end up causing cancer and fibrosis? Well, it starts with too many carbs and especially with fructose. As we've discussed many times, fructose goes mainline straight to the liver. And the more carbs you get in your liver cells, the more those liver cells grow. Just like fat cells, liver cells take carbs and they turn them into fat. In addition, liver cells will take fat and bring them into that liver cell as well. Seed oils are difficult for the body to break down. So yes, there's some risk factor associated with that. Without going too much further into this geeky slide, we'll go to the next one, which is a little bit more of a cartoon, but again, it gives you a little bit more mechanism and understanding. What happens when you get all of that fat in the liver cell? You know, Jesus was trying to think of a good analogy, and I think he did. He said, you know, imagine taking an elephant and stuffing it into your refrigerator. So the liver cell is the refrigerator. The fat globules are the elephant. As you continue to push that into your refrigerator, you lose space for anything else. And guess what happens next? You keep pushing on that elephant, it keeps growing. It's going to burst your refrigerator. And that's what happens with these liver cells. They burst. The enzymes that you normally see inside those liver cells, ALT, AST, those burst as well. The body starts going into cleanup mode. The immune system gets activated. And again, as usual, you start seeing scarring. So that's how you go from high fructose diets, high carb diets, to the elephant in the refrigerator of your liver cells, to bursted liver cells, liver damage, and liver cirrhosis, and finally, liver cancer. Speaking of geeks, I had to put this one in here. Jesus laughed at it, but the point here was when you look at you see some relatively healthy pink cells up at the top. These are liver cells. These are actual microscope views of liver cells going through stages of fatty liver. You see these liver cells, these little white bubbles, that's the fat globules in those liver cells. So those of you that are not geeks, thanks for hanging in there with us. I think that's it for the geeky part. Jesus, Heather, anything else to add before we go on? You want to at least say hello?
Oh yeah, definitely. Let me pull Heather back to the stage. Hey Heather, how are you?
Hello, good morning.
Let me tell you something. I'm really proud of Dr. Brewer for managing that well. As you see, we're making some changes, and even though for those who are new to the channel, whenever he says Jesus, he's talking about me. He's not calling a superior
that would be
entity
Jesus
out there. Yeah.
He's Jesus. You're just a Jesus.
Yeah, that's correct. All right. So yeah, and we wanted to bring this out quickly and as effectively as possible. As we discussed, this article, we're gonna put the link in the description for you. They're really keen on Mediterranean diet, and we agree with Mediterranean diet when it's low on whole grains, and that's the whole point they're bringing up. Like whole grains equals fiber. That's why it's good. I hope that list helps you out. If you're eating that stuff already, wonderful. If you're not, you might want to give it a chance. Heather, do you have some thoughts about it?
No, I think you handled it really well and explained, both sides of the coin there for the audience, and then the more advanced geek, as he references, audience as well.
All right. So let's go without further ado. Let's go to the Q&A. As long as Dr. Brewer, we have some feedback audio in there. Okay, good. So as long as Dr. Brewer stays on track, we can go here more quickly. So
he's got room to talk. He has gotten into the director producer role, and I used to call him Jesus B. DeMille but nobody. That's all my. Cecil B. DeMille was the guy that did the Ten Commandments and some of those really old mega movies. The guy that had the riding crop. Yeah, he's also the answer Nazi. For the today's younger crowd, I think we just have to call him Jesus Tarantino.
I like it. All right. So, JD, thank you so much for becoming a member as well as Last Laser Harvest. What are the perks of becoming a YouTube member? Just go there, click on join. It's a couple of bucks a month, and you will get your questions answers first. So that's the perk. If you don't want to be a member, just subscribe to the channel. That helps a lot as well. All right. So let's see what we have here. Rick Folia, good morning from Atlanta. Thank you so much, Rick. Joe SXM, is there a better time of the day to take 5 milligrams of rosuvastatin? I take magnesium glycinate and plan to keep it 2 hours away from statin. Okay to take aspirin at the same time? This is more of a pharmacological question for Dr. Brewer. Any thoughts?
Either of you have any thoughts?
Not really. I'll have to dive in, but I'm not aware of any contraindication to even take them together. Magnesium is a big deal because you do want to take it separately, just because other stuff might reduce the absorption. But if you really want to know what reduces the absorption, we have a video on it about the best magnesium for brain health, and we discuss absorption in that video. So take a look at it and share some love with that video because it didn't do well. But that answer is right there.
So a lot of people have questions about timing. I'm trying to think of areas where we have issues on timing. You know, for adults who have iron deficiency and are trying to take iron is a timing issue. You do want to take iron on an empty stomach, but niacin's not a timing issue. If you're taking any of the statins, those are not a timing issue. The blood pressure medicines, some people react to the blood pressure medicines, and especially when they're getting started, do better taking them at night. That's assuming they're not going to be getting up and getting dizzy on the way to the bathroom.
Yep. Okay. All right. Let me go to the next one. Joey T. How beneficial is to have a variety of fiber? Or can I just have some psyllium husk and call it good enough?
To me, I'll go first, and you guys can think while I'm blundering around. I know that we've had Robert Lustig on, and he's big on looking at both soluble and insoluble fiber. I don't really know enough to push back on that. So I used to think fiber was a one-trick pony, and I used to do what Joey T does in terms of just adding some psyllium husk. I do add some fiber. About half the mornings into my coffee, but that's about all I know. I know Miranda's done a lot of work in this space, and she agrees that you do need both soluble and insoluble fiber.
Heather, do you have a take on this one?
No, I would agree. Both forms of fiber, but most, should come from your high fiber foods. Definitely.
I think part of the deal of why both are important is because one fiber, as we look on the list today, has the capacity to feed the gut, to feed the bacteria in there.
Right.
And the other fiber works as an environmental thing, which allows for the positive growth of that bacteria. So one feeds the bacteria, the other one allows the bacteria to grow. That's why both are important, and that's on Dr. Lustig's metabolical book. So probably again, we're talking from the same source, who's the man who has done a lot of research, or at least made that research popular.
So which is which? Which fiber is the support, and which one is the food for those bugs?
If I remember correctly, insoluble fiber was the support, and soluble fiber was the food.
Okay.
I might have got it backwards. I don't know. All right, Joe SXM. If have known arterial blockage and high plaque load, should one worry about coffee constricting blood vessels? That's a good question. Will you be worried about that, Dr. Brewer?
I don't think you should. I don't think there's enough there. If you have enough, if your arteries are that on the edge that coffee's going to do that, something else is going to do it quickly anyway. So,
Cortisol,
not worried
adrenaline.
about,
Yes.
yeah, not worried about coffee doing that.
Yeah, and most guidelines. I know we beat up on guidelines all the time, but most guidelines suggest no more than 4 cups of coffee a day. So, I mean, if you're drinking monumental amounts of coffee every day, well, that's gonna have some risks, and that's the whole point behind the article we showed today. It's all about the dosing.
Mhm.
You can have a positive effect, but if you do too much out of it, you're gonna get a negative effect out of it.
Mhm.
Joe T, does saturated fat increase fatty liver? That's a burning question, Dr. Brewer.
Mm. There's a whole lot of people that would love to tell you that that's the case. There's major debate around saturated fats. Most of the focus and saturated fat haters talk more about deposition in the artery walls. Here's the bottom line. That's under a lot of debate right now. More recent information would indicate that saturated fat's probably not the bugaboo that we thought it was. Now, so when you consider that by the time we start aging, and when we say somebody has metabolic disease, that means that carbohydrates are causing problems for them. So fats don't have that. Over half of us have a problem with carbohydrates. Over half of us don't have a problem with fats. Fats don't stimulate insulin. They don't stimulate inflammatory processes, and I don't think they create fatty liver.
I should have brought my glasses because I want to say something, Dr. Brewer. I'm gonna say something like, actually, Dr. Brewer, there are some articles that do suggest saturated fats can increase fatty liver. There are some articles that suggest that eating protein will spike insulin or has the potential of doing that.
Protein will.
Yeah, but the whole point we're making here is it's about the dose. So if your diet is based completely out of saturated fats, there might be some risk, but we are more conservative on the side of saying we don't think it's such a big deal as carbs are, especially on processed carbohydrates and grains. All right, but a really good question, and this is another good one. Uh, if you likely have or have had hyperinsulinemia, high levels of insulin in your blood, and belly fat, can you assume that your liver is not fatty if your ALT is 11 and AST is 19? Good question. How do you find out if you have fatty liver?
Well, as you guys know, the most common thing that we look at on our battery of tests are ALT and AST, and those are good numbers for ALT. We get concerned when you see them above the mid-20s. There's more definitive testing. There's an ultrasound test, et cetera, et cetera. We don't go that deep into it because we're in the business of detecting undiagnosed prediabetes and curing it. And when the patient works with us and cures that prediabetes or manages it, takes the risk off the table, the fatty liver goes along with it.
Correct.
I think it's easier to reverse fatty liver than it is to reverse plaque.
Yes, no question.
I mean, if you want to see the cell, you can even go ahead and do a biopsy and have a needle placed right there on your liver, take a piece of it. But I don't think most people want to do that.
No.
But remember what Dr. Brewer described. Probably he butchered it a little bit, but he did try. When you're having fatty liver and you're pushing that elephant inside your fridge and the liver bursts out, the liver cell bursts out, all those enzymes are usually inside the cell working. When it bursts out, all those enzymes have to go somewhere and they will go to the bloodstream. And that's why you see an increase on those markers. But if you're taking care of that elephant, taking that out of the fridge, avoiding killing more of your liver cells, you're going to see those enzymes go low because you're keeping them where they should be inside of the cell. And remember, the liver is different to other organs because the liver has the capacity to regenerate itself, like the tail of a lizard. It will
Yeah,
grow
that's a
back.
good point.
So yeah.
While you're bringing up analogies again, so Heather, did you think I really butchered that analogy that badly?
Say yes.
I mean, I thought it was pretty good, actually, considering, we didn't practice it a whole lot and came up with it on a whim. So there you go.
Well, I stole I did admit I stole Jesus's analogy.
Yeah. He didn't like your first analogy, so it's okay.
No.
He said a balloon. And I mean, they describe it as a balloon, but you have to think out of the box, Dr. Brewer.
Yeah.
Joe SXM, with invasive angiography, how do they came up with a percentage of blockage? Just eyeball it, or does the equipment calculate? That's a wonderful question. That that goes to one of my preferred methods to find out plaque. And we already talked about needles, but I'll let you take on this one first if you want to.
No, go ahead. I'm still trying to understand the exact question. Go ahead. What?
I think it's about perception. And if you go to get a standard CT angiogram, they will inject a needle on your arm or on your leg. They will inject some dye on it so they can see it through the CT scan and see the flow of the blood with the dye on it. And it's usually calculated by eye.
Yeah.
The cardiologists, if they have the right equipment, they might be able to do some measurements, but they do that manually. Like they use the software and they place from point A to point B. Now there's a new option which uses artificial intelligence to do that, so it's more accurate. And what they do is they get the disc, they analyze all the images, and the AI will do the measurements. So it doesn't depend on the hand and somebody doing the measurements, which is kind of the downside of an ultrasound as well. Now, we're not too concerned about percentage of blockage because of, as Dr. Bruce said, the arteries have the capacity to expand as necessary. We're more concerned about the type of plaque. And that's another place where the CT angiogram with AI analysis is better, because some traditional CT angiograms might even not report soft plaque. They might say calcified, non-calcified plaque, but that's it. And the AI measures the density of the plaque. So it can differentiate between soft plaque, non-calcified plaque, or calcified plaque. So I do like that method a lot, but yes, it's invasive, it's expensive, it takes more time, so might not be for everybody.
I'm glad you answered that. I'm glad you were thinking in the new age of CT angiogram and FFA or FFR, because I was thinking about some of the others, and that was a better answer.
You have to start talking more with millennials and Gen Z, Dr. Brewer.
I know it. I hate it, but I got to.
I do hate talking with a lot of Gen Z. I got to admit, but they have some really good ideas. So that's just the way it is. True lady, over 20 years consistent, low carb and exercise, and a lean mass hyperresponder, but a BMI is 25. Now a small dense LDL is trending upward with no change on triglyceride or HDL. At age 70, is age now a driver? Small dense LDL increase has been gradual. This question is loaded with a bunch of stuff. We might need to start by defining some of that. Would you like to give it a shot?
Yeah, let me get started on that, and then that'll give you a chance to think through a better answer, Heather and Jesus. But one of the most common problems that we get when people come to see us, we follow a thing called fractionation. And usually when somebody like Tree Lady is mentioning my small dense LDL or she's talking about fractionation. Now, one of the most common errors, people come to us and they're just, we have to talk them down out of a tree because the small dense LDL is elevated, especially when people have any elevation of um, their overall LDL. Jesus, it's too bad that we don't have. I don't think we have the technology where you could go in and show those bell curves that we show patients. Do you?
Let me try it.
Okay. I'll continue to explain it while you're trying it. Now, what happens is if your total LDL is elevated, guess what? Your small dense is going to be elevated. Your medium is going to be elevated. Your large LDL is going to be elevated. And there's actually three things that we look at. We look at loss of HDL large, loss of LDL large, and overall particles. The particles, including the small dense, are the least of our concerns, especially for someone who says, I know my LDL is elevated and I'm okay with that. I don't think that's an issue. And most of our lean mass hyperresponders actually do have that opinion. So if you're a lean mass hyperresponder, Tree Lady, and you're not concerned about having a higher LDL, guess what? Your small dense LDL is going to be higher just as well as your large LDL. So it might be better to look a little bit deeper in terms of that fractionation when you're concerned about the small dense LDL. Now, the reason that became an issue, I personally think it's more of a biomarker for, again, loss of the large fluffy LDLs. One of the many debates that you see in this space on the internet is, no, LDL is really good. Once you get a little bit deeper into it, you realize that, as often happens, both sides of the argument might be right. Large, fluffy LDL is good. The ability to retain that is good because it shows you don't have a major component of metabolic disease going on. So be careful when you start looking at a lab and you see increased, quote, small dense LDL. Make sure that it's actually a reflection of loss of the large LDL and not just an increase of overall. I think I tried to repeat it to try to clarify, and I'm not sure that I clarified. Maybe I made it worse. What do y'all think?
You did such a good job on the main presentation, and then you're sending all to the.
Well, maybe one of you could clean it up for me. I hope I gave you enough time to think through and listen and say, well, he's butchering this, he's screwing this up. Clarify for us.
Heather, do you have some insights? I have some stuff on my mind, but I would like to hear from you first.
I mean, for what we try to teach patients on the fractionation is not hyper focus on the total LDL particle count, small and the medium, but we want to look at the LDL pattern and as well as the peak size of the LDL. So if you're retaining those large fluffy LDL particles, like Dr. Brewer mentioned, as well as the large fluffy HDL particles. So, but also, in regards to Tree Lady's question, is age now a driver? Age and genetics are unfortunately a couple of the components that we can't change. But it sounds like you're doing all the other things with lifestyle, low carb exercise, maintaining a good BMI, those things that we teach our patients and work with our patients on.
Wonderful. And I'm just gonna show a comment right here. Not a member. Hopefully you'll become a member, Lobster Mobility, but I want to highlight this. The lady, actually, it's a nurse practitioner. Must be very important for this team, and she is. So Dr. Brewer is supposed to be retired, and then he decided to hire a bunch of people to save lives. So he has to keep working, and we're trying to transition that. And now Heather is one of a nurse practitioners who works with us. Is very experienced now. She has been with us for a while, and she has been learning from Dr. Brewer directly. So she is really important. If you want to become a patient, you can show the banner right there. Let me do a shameless plug. Put a banner in there. Call the office 859-721-1414 or visit prepmedhealth.com. We'll be happy to see you as a patient. Now, wanted to go back to Tree Lady and the lean mass hyperresponder thing. there's a clear definition for lean mass hyperresponder, and that definition doesn't talk about BMI. It just says being athletic, and you can be athletic with a BMI of 25. It will depend on how much muscle you have.
Right.
But let's say you are let's say you are a lean mass hyperresponder. You're on a keto diet, a low carb diet, and your LDL starts going up. To me, this message has a lot of concerns regarding the small dense LDL. And the reality is, there is a difference between mechanistical elements, which is how the physiology works, or the pathophysiology of a disease, how the disease is caused works, versus what we actually see when we're seeing patients every day. And a small dense LDL, even though it's important, and we know a small dense LDL can increase inflammation, there is a lot of research that says it does, but when you see the people who has heart attacks, the small dense LDL doesn't necessarily correlate. So the
Mhm.
research is still going there. That's why we're not too concerned about small dense LDL. Now, something similar can be said about fractionation by some researchers like William Crowell, who they say fractionation doesn't matter. High LDL is high LDL. That's going to be dangerous. You need to decrease all of that, decrease the ApoB. But I think the problem with that approach, well, there are two problems with that approach. One, that is encouraging people to beat down on LDL. And some drugs, like statins, even though they're supposed to increase HDL, they can decrease HDL as well. Ezetimibe or Cetiad, which is used for decreased LDL and ApoB, also can decrease HDL. And there's plenty of evidence that say that HDL is a protective factor. So just a perspective on all or nothing probably is not the best. And that's my segue for Dr. Brewer to explain the chart that I'm going to put here on the screen right now.
Oh, look at that. You were able to get it there. Now, can you take down that? There we go. So this, if you'll look at this, this is the bell curves behind fractionation. So, Jesus, are you able to show your cursor on this?
No, I'm sorry. You're going to have to imagine that.
Okay, so if you look down at the bottom, you see labels for HDL and LDL, and then even IDL. You also see small and large bands within the HDL and LDL bell curves. So the HDL is this bell curve on the left, and you look at it and you say, that's not a bell curve. It looks like maybe maybe it used to be a bell curve, but maybe a shark came along and bit out a big chunk of it. It's got a ragged chunk right up at the top, and you lost a big chunk of that. Came out of the blue band, the HDL large, which you see up at the top of the image. So this is actually the bell curves of someone who's got metabolic disease. And one of the things that appears to be going on is that they are losing their HDL large. If you can get that blue and tan image of the particles, that would be even better. But you got me started on asking for images now. Anyhow, for those of us looking at this, you've lost the HDL large band. And why? That HDL large is being used up. It's being burned up and used in parts making IDL, making VLDL, and making chylomicron remnant cholesterol. So that's where that's going. Now, the same thing happens with the LDL bell curve, except it doesn't react with that shark bite when it gets changed. It reacts more by getting skewed, and it gets skewed low. Just like in the HDL pattern, LDL will start losing LDL large. And again, the same thing is happening. Those LDL large particles are being used up to form IDL, VLDL, and chylomicron remnant the big particles that have a lot of fat in them, a lot of triglyceride. And again, those particles are getting burned and used. So what you begin to see when you see all of this is people go back and used to think of, well, good cholesterol and bad cholesterol. What made them think of that? It was because somebody decided to apply a gas GCMS, gas chromatography mass spec. These were physics tools that were being used in physics. Then there was a guy who happened to be both a physicist and a physician, and he said, "Oh, what if I apply this tool?" And what he found was you have this whole spectrum of cholesterol particles. And that led to this thing about, oh, HDL is good, LDL is bad. And that, again, the cholesterol is the same. What's going on is you have a whole host of different particles with different kinds of protein and different sizes. And the equilibrium of those proteins and the sizes of those proteins is driven by the amount of triglyceride we have in our body. And that amount of triglyceride is really one of the best markers for metabolic disease. Maybe they got way too geeky. I don't know. Any clarifications on that?
Way to go, Dr. Brewer. And I think that's why people say HDL is good and LDL is bad, because that's simpler.
Yeah.
But it's not that simple. I mean,
But it's not true.
It's not like that's the problem. And when I said I had two problems with the approach of just LDL is bad, that's the second problem. If you're hyper focused on decreasing LDL, you miss all the other risk factors, including the main one, which to us is insulin resistance. That's why you still see heart attacks. Even people are on a very high dose of statins with a very low LDL and ApoB, and still they have a heart attack. So we're not saying not to decrease your LDL. If you're concerned about it, go for it. Decrease your LDL and ApoB. But don't neglect insulin resistance.
Right. Whatever you do regarding cholesterol, don't neglect insulin resistance. Really good way of putting that.
And Joe SXM want to say thanks for getting me concerned about this stuff. I had my CIMT, the carotid intermediate thickness test, this week, and I had an arterial H of 80. That's not a good result. And a possible more than 50% blockage in left carotid. Working hard on prevention. I will be interested to see if there was any soft plaque, because that's the other thing.
Yeah.
Maybe you're already working on it and you're developing some calcified stable plaque, which is also actually a good thing.
Right.
Now, I haven't asked about this, Dr. Brewer. What's your opinion on, let me see if I pronounce this correctly, endarterectomies? Endarterectomies? Taking out the plaque from...
So I used to, in med school, this is, gosh, what was this? 40 something years ago now. I trained, my surgery rotation was under, I think the name was Louis B. Jenkins. He was the carotid endarterectomy guy. And he was a high volume carotid, it's taking the inside of the artery out of the artery in the neck, because they thought that was going to fix stroke and prevent stroke. Well, I won't say that they don't do those anymore. They do, but it is very unusual. Now, why is that? Because it didn't work. And you see Heather nodding her head over there. She knows it's not the amount of plaque, the amount of goo, the amount of gunk that's lining that artery wall. It's the stability of that plaque.
That's right.
All right. Thank you so much. I want to take on this question, Dr. Brewer. I want to answer it first. Thank you so much, Bill Courtney, for becoming a YouTube member. And as you know, we're always open to conversations, because if we're wrong, we want to know we're wrong and fix that, right? That's the whole ideology behind a researcher or somebody who's concerned about science. Science evolves every day. So as I understand from Dr. Stephen Finney, are you familiar with Dr. Stephen Finney? I'm not.
I've heard that name many times, but I haven't gone deep in his stuff, so I don't know. I don't know what he's saying.
Well, I cannot say what Dr. Feeney says. I haven't heard of it, but let's just tackle on what Bill says here. Excess sugar consumption is converted to palmitic acid, might be saturated fat, and that is the major contribution to fatty liver. Yes or no? So those who don't eat fat and a high carb diet think they're not exposed to fat and are mistaken. So what I have seen is actually the other way
Well,
around. I have seen that a low fat diet with high carbs
Mhm.
do can be converted to palmitic acid, and yes, palmitic
hmm
acid can be inflammatory. Now, guess what the main source of palmitic acid is? Soybean oil.
Mhm.
So soybean oil is not one of those oils we recommend. We
hmm
recommend either olive oil, extra virgin olive oil, or even coconut oil, or even avocado oil.
Mhm.
But I don't think we even recommend cooking with those. We I don't know. Do you recommend cooking with any oil? I try not to, just because of the trans fats, and maybe saturated fats have a lesser risk of causing that. But what do you think about cooking with oils? What do you think about palmitic oil or palmitic acid?
Heather, that's a hard one. I didn't know it, so that's why I wanted to
Yeah,
put
it
you
is.
on the
I mean,
spot.
as far as cooking in oil, I mean, you try not to, like Dr. Vega was mentioning. Um, but I don't know enough about palmitic oil to really. I
Pa-
learned it's from soybean oil, so that's good. I mean, now that I know that.
I,
Mhm.
and I think what Bill is saying is that Steve Finney is saying that palmitic uh, acid is it's the most common fatty acid, saturated fat that we see in our body. And it's not because we're all eating soybeans, it's because that's what our body makes.
Yeah.
And yes, our body does make that from sugar. It makes it from carbohydrates. It makes it from protein. And I think what Courtney and maybe Finney are saying is that, you know, here, and it's his last point. People think, oh, well, I want to eat a low fat diet, so I'm going to eat a lot of carbs.
Mhm.
And I think he's exactly right. That's
Oh,
exactly what
I
we
got it
believe.
backwards. I'm sorry.
Yeah.
I got it
And
backwards. Yeah.
I think that's exactly what we believe as well, Bill, that if you want to stay thin, you eat more fat. And if you want to have problems with generating fat, you eat a lot of sugar and carbs because your body's going to
Convert.
turn that into fat.
Yeah. You have experience with low fat diet, right, Dr. Burr? I
I
mean,
do.
I
That
do
was the thing 40 years ago.
I do at some extent. That's what I was taught even 10 years ago. I was taught that on med school, but
I was
I never really practiced that. So
I was able to maintain a thin body, a low BMI, and low body fat using a low fat diet, but it's harder. It is a lot harder.
yep.
And when we know that because carbs stimulate insulin, and insulin stops fat burning. So that the low fat diet makes it very, very difficult to burn fat.
Mhm.
Definitely. Now, I want to address maybe a couple of questions and see if we can wrap it up before the hour mark. Joe
Looks
Weston,
like you might actually be successful at that today,
well,
Jesus.
that was that as usual. If it doesn't go as planned, I get the blame. But if it goes
Yeah,
well, you get the credit because you did
and
do the
rightly
list
so.
really quick.
Mhm.
Joe SXM, with CIMT, is heterogeneous plaque just plaque with calcium sprinkled randomly, or is it a calcium cap and a soft plaque underneath? Really good question. I'm not gonna answer that yet, and there's a reason why. We have a big video coming up, probably tomorrow, hopefully. We're planning on publishing that, and we're answering that exact question in that video. So stay tuned, wait for it. It's gonna come out tomorrow. You want to see that video.
That is, if I quit delaying rollout by new thumbnail ideas and things like that.
Yeah, Dr. Burr's blame on that one. Laser harvest. I try to keep away from carbs as much as reasonably possible. wanted to try carnivore for a while and see how that goes. Yeah, it's all about experimenting. We're not as against as carnivore diet as a lot of mainstream doctors may be,
Mhm.
but we don't also recommend carnivore diet for everybody. It's about finding out what works for you.
It's very simple and very easy if you're trying to manage your carbs to say, I'm just going to go carnivore.
Yep.
Yep.
The problem is, and that's the big that's the deal is there's not enough research to know long-term carnivore what happens.
Yep.
The assumption is that it's healthy for a group, and another
Mhm.
group the assumption is, oh, it's loaded with saturated fats, it's going to be unhealthy. And we do one, at least I think that the problem with research on that field is that it can be deemed as unethical right from the beginning, and it's hard to get the research, so you can only now focus on the experience of some providers and the experience of people who share their story to see if it works or not. And you cannot go back just to research. There are plenty of research papers, but I haven't seen one research, long term, standardized, randomized control, that say that it's healthy. And
Mm.
just by planning the study alone, it's hard. So
Yeah.
I don't know if we're gonna ever see that research. That's why we're not saying it's not healthy. We're just saying that it might not be for everybody. It depends.
Right.
Joey T, what does drinking alcohol actually do that damages your heart? Prefer prefers the geeky answer.
I will
Joey
tell
T,
you one.
yeah.
I'll tell you one thing it does, and this was just discovered over the past 5 years for people with atrial fib. They started finding that alcohol actually. So I've got 4Q25. It's you asked for the geeky stuff, so here it comes. 4Q25 is a gene that makes so here's what happens with your muscle cells in the heart. There are muscle cells, and then there are conduction cells. Those muscle cells actually, as they age and grow, can turn into conduction cells. People with 4Q25, our heart muscle cells turn into conduction cells faster. So you get more of these tracks laid down, and you can end up with one that goes in a circle, causing atrial fib. Again, we may need some translation, but that's some of the basics. Now, what does alcohol do? There was some research over the past few years, and more of it. So we know that that's happening. Alcohol actually increases your probability of developing atrial fib. It's not clear why, but one of the potential mechanisms is doing what 4Q25 does, and that is turning that heart muscle cell into more of a heart conduction cell. Any ideas about translating any of that?
I'm just gonna say one thing. Calcium. So calcium has a lot to do with alcohol and the effects on multiple places, including electrical conduction in the heart. You do need calcium to trigger part of that process. There's a dance between the content inside the cell and the content outside the cells. So you have potassium, sodium, chloride, calcium going in and out all the time in a balance. And what alcohol does, it can mess up some of the receptors for calcium, some of the receptors of the nervous system that control blood pressure, uh, electrical conduction, and it has an effect on that. So that's why you see that a small intake of alcohol can actually make you relax the blood vessels, can decrease blood pressure. But when you overdo it, it will have the opposite effect because it's triggering some of those mechanisms at a nervous system and vascular level. So that's a problem with alcohol. It can work in every vessel, and it can have those effects basically on every vessel. It can also mess up with some of the hormones related to blood pressure, renin,
Mhm.
angiotensin. So there's multiple places where alcohol can be a problem. And then you go back to the liver. If you have fatty liver because of alcohol, that's gonna mess up all your process of, we didn't mention this, detoxification, which I hate that word. but because it's just to scam people with just quick, unhealthy solutions. But the liver does detoxify the body, cleaning it up with all those enzymes. And when the alcohol is in and it hurts the liver cells, your body just can't do that. And you have an excess of oxidative stress, and inflammation leads to cardiovascular inflammation, leads to plaque. All right.
4 minutes, 45 seconds, Jesus.
Well, I think we should wrap it up.
Well,
I
got a couple of comments.
Oh, yeah,
before
go
we
ahead.
Number one, to your point about, I'll add to your points about all the different challenges with alcohol, and some good, some bad. It's like the alcohol's impact on sleep. A lot of people think, oh, I'll take some alcohol and it's going to help me go to sleep. It does help you go to sleep, but it ruins the sleep that you get. And so overall, long-term, alcohol is really bad for sleep.
Mm-hmm.
The other comment that I wanted to make before we go has to do with JMK's comment about Malcolm Kendrick. I'm recognizing that name. I'm not remembering and I think I've seen some of his stuff, but I will say this. The point that JMK is making, I think, is very true. And I personally believe that neither large fluffies nor small dense LDLs damage the coronary glycocalyx or the endothelium. I think that they're biomarkers of metabolic disease. And that's the way I use them. And we do. Well, that's the first thing we look at: triglycerides and HDL
ratio. Yep.
Yeah. I think it's not worth decreasing your LDL if that means that you're going to decrease your HDL as well.
Yep.
That's what we are mostly concerned about. All right. So thank you so much for joining today. Just want to give you a reminder. Thank you, Heather. As I mentioned, Heather is one of the nurse practitioners at PrepMed working with Dr. Brewer. She's fantastic with patients. I have seen the way she works. So when Dr. Brewer finally retires, you're going to be seeing Heather. So it's good for you to know who she is. And if you want to become a patient, again, call 859-721-1414 or visit prepmedhealth.com to see the options we have for you. Unfortunately, Dr. Brewer, we only have one of him.
That's right.
But we're working on having a team that is capable enough to help you out, and Heather's part of the team. Thank you so much, Dr. Brewer. Wanna wrap it up?
Well, you wanted me to wrap it up with that Tony the Tiger thing, right?
No, do something else. That was goofy, but I think it's wearing out.
Okay.
People here, if you're watching the stream and you have been here for the full hour, by now you know that you should not be eating cereal. So
yeah, for those of you who don't know, don't let Tony the Tiger take over dinner. And regarding Heather, yes, we've had a few comments. Heather's a very smart person, and she's very, very patient oriented. She actually listens, and she does good prep work to make sure she understands the case before going in there. So all very, very good things.
Thank you all for your kind remarks. Appreciate it. Learn from some of the best right here. Dr. Brewer and Dr. Vega. Appreciate y'all and the whole team.
Very good.
All right.
That's it for me.
Oh, well, see you next week then. Oh,
thanks for your interest.
Before you leave, let me hype it up. Next week, we have an interview with Dr. Westman just for you. So don't miss out.
Eric Westman.
Yeah. All right.
See Excited to see it.
Yeah.
Bye-bye.
Peace.
All right.
Bye-bye.